So this video is for people who live outside of southeast Queensland who may have some distance to be able to travel into Brisbane to be able to have their surgery conducted. So the first thing to say is that we do a lot of telemedicine care. So a lot of your clinic appointments can be done by telemedicine. And many people find that that's a really excellent service, and we can provide pretty much a very identical level of care by telemedicine, because we can access all of your imaging online and we can talk with you and we can evaluate your hip online. And if it comes a case where we do actually need you face to face, because there's some degree of uncertainty, I need to actually see you, we can always organise for you to come down then. So suffice to say, a lot of people can be managed in the majority by telemedicine services if they live out of town and it's inconvenient to come in. The other thing to say is that a lot of people might intermittently be coming back and forth into Brisbane. And a lot of our appointments are reasonably flexible in terms of their timing. So it's not always necessary, for instance, to come to the appointment at, for instance, week 6 after your hip surgery. It could be delayed until week 8 or week 10, and it really depends on the circumstance. So if you are planning a trip to Brisbane for other reasons, then one option is to just delay or bring your appointment with us forward, so that we can tie them in together, and we do that quite a lot. It's a very convenient way for a lot of people who are coming in and out of Brisbane. For people who are coming to Brisbane to have surgery under my care at St Andrew's War Memorial Hospital, a lot of people would take the opportunity to come and see me in the clinic the day prior to their surgery, so that they've got an opportunity to be able to ask any final questions and clarify any doubtful points about their operation. A lot of people then would stay overnight in a hotel and admit to surgery the next day. Now, most people who live in Brisbane or close thereby would usually stay in hospital probably about 2 nights, give or take, depending on progress. It's quite individual. For people who live a fair distance out of Brisbane, whether they're driving home or flying home, I usually recommend that you stay a little longer. So it's probably a worthwhile investment staying, instead of your standard sort of 2 nights, you might stay 3 or 4 nights, particularly if you're trying to book flights home. So the additional time you can just spend in hospital, you get the opportunity to be able to get a little bit more physiotherapy and recovery. Alternatively, if you're going really well and you prefer to be out of the hospital environment, that's fine too. So some people would choose to stay sort of 2 nights in hospital until they're confident with their mobility, and then they might find a hotel local, or alternatively stay with a friend or relative for a couple of days before they then fly home.